current overdose crisis is the most challenging and formidable public health issue of our time. This is not a federal government problem. It is a whole of society problem. The 5-point plan iterated by Secretary Azar really drives our entire program. Now, although it's 5 points, there's really 73 strategies around those points and hundreds of individual programs. The cornerstone is to improve the treatment for those who are currently addicted while preventing others from becoming addicted in the first place. That means not prescribing opioids when safer drugs could be prescribed, prescribing opioids in a limited amount when that's appropriate, but also preserving opioids for those people who are really in pain who have no other alternative. Well over 1 million people are now receiving medication-assisted treatment. Our naloxone distribution has gone up over 600% within the last 2 years. So we really are at a turning point where we're starting to get a hold of the overdose crisis. However, we can't lose sight of the fact that this crisis is evolving. It's different, it's heterogeneous, and there are many parts of our society who are still suffering.
One of the most important messages of our opioid summit is that stakeholders from different areas in policy, in healthcare delivery, in communities need to work together to solve this problem. Our state, Michigan, is partnering with the federal government through the Medicaid program to make treatment and counseling more readily available for individuals who are dependent or addicted to opioids. They're also working with the University of Michigan and physicians across the state to try and get better data out about how opioids are being used and to reduce the overuse of opioids after surgical procedures or after visits to emergency departments. These are important partnerships among universities here in Michigan, as well as our state health department and Medicaid program and the federal government to use funding most effectively to provide services in the community that will help people who are suffering from problems with opioids.
On the level of general prescribing advice, the Center for Disease Control issued a lot of guidelines within the last couple of years, and all of the health plans in Michigan get together through an organization that distills it into one set of health plan recommendations, and we then issued a set of health plan guidelines for prescribing through this organization to try to give a clear, singular message to all the practitioners in the state. What we have today is a care model that everyone is motivated to do their best in, but the care model isn't succeeding in achieving our public health goals. That means that we have to change the nature of the prescriptions so that we can reduce the misuse of the prescribed opioids. The expertise relative to what care ought to be given doesn't reside at the health plan. It resides at the University of Michigan through M.P.P and through other representatives of the provider community. Our role is to create a payment model that speeds up the conversion from current practice to this best practice. We basically work with the people at the university to understand which are the key areas that need to be changed, and we create a payment model that facilitates that.